The floods affected the country in August, and although the fatality has been around 1,500 people have been killed, but over 20 million people have been affected, not just in one concentrated area, but scattered throughout the whole of Pakistan, from north down to south. The floods in Pakistan has been described as worse than the tsunami, the earthquake in 2005 and the Haiti earthquake all put together. We've had livestock which has been killed, their land has all been destroyed, their homes which they had been washed away by the floods. It's hard to describe seeing what these people are going through just because they have nowhere to go. Made in Europe have always been a very key supporter and partner of Islamic Help. They support Islamic Help in our campaigning, our lobbying, but most importantly, they develop and train volunteers, young, dynamic, enthusiastic volunteers who are ready to fly out to various disaster areas with Islamic Help and help with their skills that they've developed and they've been trained in by Made in Europe.
So far, what we've been doing is trying to set up some of the water purification units, and I've been mainly working on setting up the cholera hospital or the anti-diarrheal clinic.
We have a couple of volunteers who've been provided by Made in Europe. They've become a key asset to Islamic Help and they've stuck in, you know, and the great thing about these volunteers are they come from various different backgrounds. I mean, the one at the moment who's here is a medical student, so she helps out with the medical work and supports the hospital.
We just set up the cholera clinic, and one of the first patients there was a 2-year-old child and has cholera. Basically, it's quite a severe form of cholera. What the doctors have done is they've inserted IV solutions on the vein of the baby. What they've also done is they've inserted a tube from its rectum to a bag to collect the stool. Without the treatment, without their healthcare of the paramedics, the doctors, the nurses to monitor the patient, the chances of survival is really low. When you actually see the patients and you just see what the disease actually is, because you just hear about it, you never actually see it with your own eyes. It's completely different and it just breaks your heart sometimes. I
would definitely endorse Made in Europe as a viable organisation who provides excellent training and is able to support any other NGOs who require that kind of assistance in training volunteers. When I told everyone I was coming here, they were really proud of me, and I have volunteered in overseas before, but when I came here it was completely different, and it's probably the hardest thing I've ever done in my whole life. They're reliant on literally people like us, whether we're rich, poor students or not. There's a lot of things that we can do, whether it's like raising money to come and volunteer or just raise money to donate a water purification unit. Anything, literally anything contributes to saving lives.